Today I'm joined by Dr Louise Newson.
Dr Louise Newson,
A menopause specialist.
Founder of Newson Health.
A leading voice in women's hormone health in the UK.
She's a Sunday Times best-selling author and host of the UK's #1 medical
Without
podcast.
hormones, people get osteosarcopenia, so loss of bone and muscle mass. It's physiological fact.
The estrogen and testosterone helps enormously. And I know, because I've probably sent between 50 and 100 women here over the last 5 years.
Now, menopause is a hormone deficiency with health risks.
Yeah.
It's low estrogen, low progesterone, low testosterone.
Will that help menopausal and postmenopausal women?
But I feel very sad when women think that they're going to be able to exercise and eat their way out of a hormone deficiency. Testosterone deficiency is probably the one that's missed the most.
Yeah.
People often don't realise until they're older.
Now, are there side effects to taking a level of testosterone that would be classified as too high? Is there a downside?
I would be more inclined to think about testosterone more than just giving them estrogen.
Yeah. Why would someone like me, an online fitness coach, be here with someone like Dr Louise Newson? And the reason for that is because I coach many women, over 50 women, from all ages, very young, but the majority from 30 to 70. And there are many perimenopausal, live menopausal, postmenopausal, who even through all the social media and access to information will still ignore what they see and just think it's okay to feel like this. This is just the normal. Anxiety and brain fog and extreme tiredness and the itchy ear and the cold shoulder, and you can get out of that. And yes, I always say, let's have a blood test, check your hormone panel. What is your estrogen level? What is your progesterone level? What's your testosterone level? But fortunately, I would say 5 out of 10, if they've come to me at the right time, yes, their diet has been really poor and they don't do any type of training, but it's like, I have to change my life, and they're like, right. So I would say you have to hit these targets. You have to eat this amount of protein, eat this amount of carbohydrates, eat these amount of fats, which will support your hormones. Start weight training with this plan. Start doing this amount of steps. Fortunately, most will say, well, after 4 weeks, I'm like a new person without any HRT. But there are some that unfortunately just have gone past that point where they end up getting a blood test and their estrogen levels are 0. And the estrogen and testosterone helps enormously. And I know, because I've probably sent between 50 and 100 women here over the last 5 years. And specifically, where I really got into helping women was there were 2 reasons. My wife and my wife's very close friend, who will probably be watching this, about 5 or 6 years ago, was always running and trying to get fit, but it wasn't coming off how it should. Believing the old-fashioned sprint up and down hills and fast till 1 o'clock and have a chicken breast at 4 o'clock and a tiny dinner, and not fueling that body. Anyway, there was some crying in the kitchen, so I went in and was like, what's wrong? And she just said, I'm just so tired, I can't get out of bed. I have to drag myself out of bed. And I said, okay, I can try and help. Have you been to the doctor? And yeah, I've been to the doctor, and the doctor asked for a blood test, and we got the blood test and everything was fine, and said you need to take antidepressants. And I said, right, can I see a copy of it? And I'm not a doctor, I'm not going to pretend to be one, but from all the years I've been dealing with hormone optimization for men and women, I know what to look at, and I can say something, you go and get it verified. The first thing I was going to look at was her estrogen, and it was the number 0. I said, well, did the doctor, and I tried to be subtle before, like, oh my God, did the doctor tell you that you had no estrogen in your body? And they said, no, they said everything was fine and to take antidepressants. So one thing they tried, they said, go to Newson Health, show them the bloods, and I expect you're going to go on HRT and become a new person. And then 6 weeks later, she was at the door and basically gave me a huge hug and just said, thank you. And that was that. Now, there are lots of those examples. And what would you say to women in that position that have gone to a doctor and said, "You're fine, take these pills," when that's not the answer? And do you think genuinely that weight training and eating the right foods to support that body of theirs and getting the right amount of steps in a day, will that help perimenopausal, menopausal and postmenopausal women?
So, quite a lot to unpick there.
Yeah. Good background.
Good background, and sadly, it's a really, really common story. About 1 in 3 menopausal women are prescribed antidepressants.
Yeah.
And only about 1 in 10 are prescribed hormones. Now, menopause is a hormone deficiency with health risks.
Yeah.
It's low estrogen, estradiol, the most important estrogen, low progesterone. Testosterone deficiency usually starts late 20s, 30s. So it's not really menopause, it's just an age-related decline. Now, I feel very strongly eating, exercising, absolutely. It's like the foundation. We all should do it, regardless of our hormones. But I feel very sad when women think that they're going to be able to exercise and eat their way out of a hormone deficiency.
Right.
And of course our muscles are metabolically active. Our muscles will produce some hormones.
Yeah.
So people will feel better. But even personally, about 10 years ago, I do regular yoga. I eat really healthy. I don't eat processed foods. I don't drink alcohol. I don't do caffeine. I get migraines. So I'm really a bit obsessed about what I eat, my routines.
Yeah.
But I was really struggling with my joint pain. My migraines were a lot more severe. My mood was terrible. You describe that fatigue of just not being able to lift your head off the pillow. I mean, it's like almost, I kept saying to my husband, I feel like I've been drugged.
Yeah.
Like I didn't even feel this tired when I was pregnant. So if I'd met you then, and you'd said to me, right, Louise, you need to do this, 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 and this, I would have said, well, yeah, sure, but give me the energy, give me the strength.
Yeah.
Like, I know I could and should, but I can't. But I've also come from being really healthy. So what's all happened to me, you know? So, but you wouldn't say that to someone. If someone was tired because they had low iron, you wouldn't go, well, just keep exercising and you'll be better. You'd say, right, have some iron and carry on exercising. And the chances are you'll exercise even better and have more energy.
Yeah.
And I think this is what's trying to change the narrative. I mean, my work is a lot about educating women so they have a choice, and men, actually, educating anyone, not just about menopause, but hormones. Because the problem is, ever since we're teenagers, as women, we're told our hormones will affect us mentally and physically. You just got to suck it up. It's just the way it is. No disrespect to men, but if you were said to men, for a few days every month, you will feel tired, you won't feel like exercising, you'll be a bit crabby.
Yeah.
You go, well, no, I want to exercise every day. So it's about shifting what is normal and what's not normal and what we can do about it. And so thinking about the way our hormones have a massive effect on our bone, our body, our muscles, our metabolism, is getting it also away from just symptoms. Because if a woman has symptoms or not, it's almost irrelevant when you're talking about low hormones. Because if they've got low hormones, they've got health risks that need to be addressed, and thinking about hormones in a different way.
So what are the health risks, would you say, when hormones?
Yeah.
When you say hormones, are you talking about estradiol?
About progesterone, estradiol, testosterone, all three.
Yeah.
Men and women have those three hormones, but they work on every single cell in our body, like every other hormone does. So these are natural hormones that I'm talking about that we produce when we're younger.
Yeah.
So they're made in our ovaries, they're made in our brains, they're made in our adrenal glands. Our heart even makes estradiol. Our muscles will make some hormones as well. But they get squeezed into our blood. Every single cell works better in the presence of those hormones. They help reduce inflammation in the body.
Yeah.
So when we don't have good levels of hormones, same for men. If the men have got low testosterone, they've got more inflammation in their body.
Yeah.
More inflammation increases risk of inflammatory conditions.
Yeah.
The most common causes of death are heart disease and dementia. These are inflammatory conditions. Cancer is an inflammatory condition. Dementia, I've already said inflammatory. Depression, osteoporosis, inflammatory bowel disease, other neurodegenerative diseases like multiple sclerosis, motor neuron disease. These are all inflammatory conditions.
Yeah.
A lot of them are related to age, but lower your hormones, increase inflammation, you've got a higher risk of all these conditions.
Yeah.
And it's important because, you know, as men and women, we're living longer, but women are living often the last 10 years of their lives in poor health,
Yeah.
which can be improved by having hormones.
Yeah. Okay. So for many women watching this, their symptoms didn't creep in. They hit hard.
Yeah.
The anxiety, the low mood, weight gain, poor sleep, brain fog. From your clinical experience, what are the earliest hormonal changes that are most often missed or mislabeled?
Well, all three, to be honest, but I think testosterone deficiency is probably the one that's missed the most.
Yeah.
Because it starts to decline quite young, and people often don't realise until they're older. And it's like anything, you don't know what you're missing until you get it back.
Yeah.
Same with progesterone, actually. Progesterone has always been considered as a hormone you give just to help regulate periods or keep the lining of the womb thin if people are on HRT. But progesterone is a neurosteroid, it's made in the brain. It has really important and beneficial effects on mood, on sleep, on cognition. It helps the heart, it helps the bones. A lot of women who have heavy periods have low progesterone, but then they're often given the contraceptive, which doesn't contain progesterone at all. It contains a synthetic progestogen,
Right.
which is a chemical that blocks your hormones working in your body. So
Yeah,
again,
'cause it has-
people aren't understanding the difference between the natural and the synthetic hormones and the benefits that you have of having them back.
Yeah.
So also the other thing you're saying about the blood test is really interesting, because a lot of laboratories are set up to only alert if the blood tests are high, not if they're low. So again, I see a lot of women who have testosterone of 0.3, 0.6, and the labs say normal, because they're only set up to see if they're high. So again, for people listening or watching, if they have a blood test, get the absolute number. Don't just get the normal, abnormal.
Well,
feedback.
with the labs I use and recommend my clients in the UK, it's a big blood taking company. You do get to see
Yeah.
low and high.
Yeah.
So what, in your opinion, on that is the minimum for perimenopausal or menopausal
You see, this is
testosterone?
where blood tests need to be interpreted with caution, because certainly if someone's perimenopausal, their hormone levels are fluctuating quite a lot.
Yeah.
So you could do 10 different blood tests in a day and you'd get 10 different results.
Yeah.
So a low level or a normal level doesn't actually give you a definitive diagnosis. If it's low, it just says at the time the blood was taken, it was low, but it doesn't mean it's always low, if you see what I mean.
Right.
Testosterone is more useful because if it's low, then it usually stays low.
Yeah.
But again, the range depends on the laboratories, and the female range, when you look at the studies they've used to determine the range, it's only done on a very small number of people, actually.
Yeah.
So again, what's normal? We're all different.
Well,
So-
don't those blood companies rely on certain numbers from a certain society that will say this is the minimum for
Yeah.
women between 40 and 60? That's your minimum. That's what you need to put
Yeah.
on your test, and this is high. And then they can tell you, well, yours is 0.4 and it's classified as normal.
Well, not really, because when you look at the studies that they've used to get their ranges, they're from a very small number of women, and everyone's different.
Yeah.
The other thing is that, you know, women can start having low hormones from quite early on. So, you know, about 1 in 30 women under the age of 40 have an early menopause. So what's normal, if you like, for a woman who's menopausal at age 51, the blood result's going to be very different when they're menopausal age
Yeah, of course.
21. Do you see what I mean?
Yeah,
So,
yeah, for sure.
And it's the same in anything in medicine. Any test, whether it's a scan or a blood test, has to be done in conjunction with talking to the patient. So I've seen women, for example, who've had normal blood tests. They come in, they tell me they've had 2 periods in the last 6 months. They're getting all the symptoms, like you say, the brain fog, the memory problems, the low mood, itchy skin, palpitations, urinary tract symptoms. Well, I don't have to be a brain surgeon to work out it's probably related to their hormones.
Yeah.
You know, I've excluded other causes. They say, but I feel exactly like this normally before my periods for a couple of days, but now it's happening all the time. So then, as a doctor, you give them a therapeutic trial. You say, well, try some hormones and see if you feel better.
Are there side effects to taking a level of testosterone that would be classified as too high? Is there a downside?
So not usually. If it's all about giving the right dose to the right person at the right time. And so when people are testosterone deficient, so they've got low testosterone, they've got a low free androgen index, and they've got symptoms of suggestive of testosterone deficiency. But as you know, the symptoms can be quite vague. Like, you know,
But do the symptoms marry up with low estradiol symptoms?
Yeah, they can do.
Is it the same?
Yeah, they can do.
Can you determine which one?
Yeah, so if someone, say for example, I see someone in my clinic who's got regular periods, so she's having regular periods every 28 days or so.
Yeah.
She's then probably producing quite good amounts of oestrogen and progesterone.
Right.
But she's also got symptoms suggestive of testosterone deficiency and her testosterone level's low.
So what would those symptoms be?
So it's usually the
on that
low
basis?
mood, the reduced motivation, the reduced stamina. Often people find that their sleep's disturbed. They might get worsening headaches, joint pains, urinary symptoms. Often, if they are working out, they say, I just can't build any muscle at all.
Yeah.
And reduced libido.
Yeah.
You know, is very common symptoms. So again, I would be more inclined to think about testosterone more than just giving them estrogen.
Yeah.
Or there might be women that are on estradiol, their estradiol level's normal, they might be on a patch or a gel and their level's fine, they're on progesterone and they're still getting all these other symptoms. And we usually do bloods, make sure that they're not low iron or they haven't got low vitamin D or there's another cause.
Yeah.
But often it is related to the testosterone.
And going back to the estradiol, would you agree with, I know it's very specific on individual, but a broad range, a healthy level of estrogen consistently would be between 500 and 700. Would you?
We usually go between sort of 250 and 1,000 because again it's on a very small number, and there are some women, especially younger women, I might see in my clinic and their level might be 400 and they're still getting symptoms. Then their level comes back and we increase the dose to 800 and they go, I feel amazing.
Yeah.
So
it's all based on the individual and the symptoms they're telling you.
Yeah, absolutely.
So my wife recently had a breast scan and a scare. And after the biopsy, I was speaking with the radiologist, and we got onto HRT because I was like, I can have a good chat with this guy. And he said, she's fine, by the way, my wife. And he said he sees many women in their 70s, and this was on the border of, I was telling my wife to go on HRT. Yeah. Because I've seen her bloods and I've seen the symptoms, and I just knew. But she wasn't sure, but this didn't help. And so the radiologist, who's quite experienced, said many women in their 70s who have been on HRT and now have widespread cancer that started in the breast, and he said, I would strongly advise against HRT because he believes the two are linked. And now my wife was just a bit terrified of taking it, but she's perimenopausal, struggling. She looks amazing now because she's... finally, after 20 years, she's let me coach her for a year. If he was sitting here now, what would you say to him?
I'd like to see the evidence that he's basing that on, for a start.
His evidence was he has seen these women come in with breast cancer or other cancers, and they've been on HRT.
Have they cleaned their teeth in the morning as well?
I'm not sure about that, but that's.
No, but I
was agree. I was saying, where's this coming from? It's like this is just from what I've seen.
So I know it sounds a bit cynical and flippant, but looking at a few patients and making sweeping statements, it's like, did they drive to the clinic while driving the car might have increased their risks? You know what I mean? So, the reason that it needs to be answered properly is that it's the biggest reason why people are scared of hormone replacement therapy is this risk of breast cancer. But if we just unpick the data, firstly, there are different types of HRT, hormone replacement. In the old days, if you like, when they first discovered hormones and commercialised them, the estrogen was made from conjugated equine estrogen, so that's pregnant horses' urine, which has got all sorts of hormones in, as you can imagine. But they also combined it with a synthetic progesterone, so a type of progesterone that isn't progesterone. The one that they used in a big randomised controlled study was medroxyprogesterone acetate. So it's a chemical that's made to look like progesterone, but not quite. So it has different effects on the body. And what they noticed was that some of those women on the combination HRT had a small increased incidence of breast cancer. It was fled to the media, put in all the medical journals, and that's when everyone said, this is terrible. This was a big study in 2002, the Women's Initiative, Health Initiative study, WHI study.
So 23 years ago.
Yeah. But when they unpicked the evidence properly, they found some quite interesting things. Firstly, women who had had a hysterectomy, their womb removed, only had the oestrogen. This was a pregnant horse's urine, oestrogen. But they had a 22% lower incidence of breast cancer. We know from other studies that oestrogen is likely to be protective of breast cancer and other cancers as well. I've already said at the beginning, reduces inflammation. So the group that had this small increased incidence of breast cancer were people taking medroxyprogesterone acetate. Now, it's now 2026. I don't prescribe medroxyprogesterone acetate. I prescribe natural progesterone.
Right.
So it has the same biological effects as our own hormone. Medroxyprogesterone acetate is still prescribed in contraceptive, by the way. So it
Right.
does have a small, but it's not statistically significant risk. But it's a small risk. Even if you look at the worst study with the worst type of HRT, the increased risk of breast cancer is less than if a woman drinks a couple of glasses of wine a night. Just to put it into context, it's very small. What this radiologist probably didn't tell you, that when the WHI study came out, about 1 in 12 women were getting breast cancer. I mean, breast cancer is common, it's about 1 in 12. HRT prescribing is less than half now of what it was 22 years ago when that study came out. But,
is it?
Yeah. But breast cancer affects around 1 in 7 women. So breast cancer incidence has increased, HRT prescribing has reduced.
I would have thought it'd be more popular now.
It's gone from 10 to 14% of menopausal women. When the WHI study came out in 2002, it's about 30% of menopausal women.
Mm.
So that means there's a lot of women out there who are struggling.
Yeah, I was really keen to get here and ask you that question because I knew you would blow it apart. I wish you were there at the time because I didn't have the stats to tell him. But, that's. I'm glad you said that. My wife would be happy.
Yeah.
You talk openly about the neglected science of hormones and how women's symptoms have historically been dismissed. Why do you think it's taken so long for hormones to be taken seriously in medicine, and what has that cost women?
Well, I think firstly they're still not taken seriously in women, but they're more seriously than they were. I think there's a few answers. Firstly, it's about women, and women are not a priority. Like, they weren't even used in studies until 1994. So a lot of evidence is based on extrapolating male data for women, which is just nonsensical, really, isn't it?
Yeah.
But also I think there's this misunderstanding of what hormones are and what HRT is. And a lot of people have, and they still do, think HRT is just for hot flushes and sweats. It's just about periods. They're forgetting what the hormones actually do. So if we spin it on its head a bit and think, what are the harms of not taking hormones? So your wife's been scared away by one person saying about breast cancer. Put that to one side.
Yeah.
Let's think about if someone who's menopausal or perimenopausal doesn't take hormones. So they've got an increased risk of having symptoms, and there can be many symptoms. Some people don't get many, but a lot of us get symptoms that can really affect our ability to function and work.
Yeah.
But there's also this increased incidence of all these inflammatory diseases that we would be exposed to with having low hormones.
Yeah.
There's 10% of menopausal women give up their jobs. There's an increased divorce rate. There's there's all of this which is real and raw. We've done some studies on addiction showing that women are more likely to be addicted to not just alcohol but also illegal substances because they're trying to escape from this cage of doom, the awful thoughts that they're getting. More likely to be medicalised with antidepressants, antipsychotics, more likely to have suicide. 1 in 6 of our patients we see have suicidal thoughts.
This is if they decide to
not
take
taking
HRT.
hormones.
HRT.
So there's and it's a bit like saying to you, what are the risks of not exercising?
Yeah.
It's similar to not taking hormones.
Lots.
But you can choose whether you exercise or not.
Yeah.
It's a choice. Whereas what I feel very sad about, and that's why I guess I work so hard, is that it's not a choice whether you take hormones or not.
Yeah.
It's really hard for women to access hormones. I can't get them from my NHS GP, the hormones that I take. Whereas if I didn't take them, I wouldn't be exercising, I wouldn't be working, I wouldn't be happily married.
What hormones is that?
Progesterone, oestrogen, testosterone, and vaginal hormones as well.
So it's the specific branding and way that...
I take a higher than licensed dose because of the
each?
estradiol. No,
Right,
of estradiol, because the patches don't stick on very well, they crinkle. I mean...
So it's the cream?
It's a patch.
The
It's
patch,
a sticky
okay.
patch. There's a gel, but it doesn't
Yeah.
absorb. It floats off my skin. So you
Right.
could give me a bath of it, and it wouldn't get into my skin.
Yeah.
So-
So the patches are better than the gel.
It varies. Everyone's different.
Right.
So, but for me, the patches are better. But one patch just crinkles, so I don't get the full amount through my skin. So I
Right.
still get symptoms. My estradiol levels are low. And then testosterone, don't prescribe. And then I use
That's a cream as well, right?
well, it's a cream or a gel. On the NHS, it's a gel.
Is there a benefit to either?
It's about absorption, actually.
Yeah, it's the
Some people
absorption rate.
absorb one better than the other, but it's the same. It's got the natural body identical testosterone in it. And then I use a vaginal hormone called progesterone, which is DHEA, so it converts to estrogen and testosterone.
Right.
Whereas on the NHS, often you can only get vaginal estrogen.
Yeah.
If I don't use the vaginal DHEA, I get urinary tract infections, and they're horrible. I don't want them.
Why
So-
do you think the NHS make it so difficult? Is it cost thing?
It's actually dirt cheap, but there's 14 million menopausal women, so anything cheap times 14
Times
million
that.
makes it more expensive.
As
There's
opposed
also-
to women
Yeah, I know.
taking
Yeah, I
antidepressants
know.
and being
Well,
told to take.
there's not big pharma behind it, and that makes a difference as well, really.
Why? That's strange, because you would think they could earn a few quid out of it if there's X amount of
By
millions,
numbers, you would
men
have
and
done.
women.
You would have thought so, but people in pharma make their most money when they bring out a new drug. So you can't bring out a new hormone because we know the chemical structure of the hormone. You can only bring out a new synthetic hormone. That's
yeah,
like
'cause
testosterone. There's more than 300 testosterones available,
Because they can't patent it,
but
can
they're
they?
not. No.
So you've said hormone dosing needs to be individualised.
Yeah.
Can you explain why estrogen or estradiol absorption through the skin varies so much between women, and why that means some women generally need higher doses than others?
Yeah, absolutely. So if we think about our skin, it is a barrier. That's what it's a living organ. It's the largest organ in our body. But, if I rubbed on sun cream, I don't want it to get into my circulation. So it works very well at keeping things out.
Right.
There's very few drugs that we can use through the skin. So if you think you can use nicotine patches, you can use fentanyl, a painkiller, and you can use estradiol because it's got small size that can just get through the skin with the right sort of vehicle, if you like. So the main ways is either a patch or a gel. In the patch, it's the glue that is impregnated with the estradiol. So you can imagine you stick it on the skin, you're trying to get it through the skin.
Yeah.
But our skin types are all really different. And also, even for any woman, where you stick the patch, it can really change the absorption. So if I stick my patch on my back or my bottom, like my bottom's got a lot more subcutaneous fat than my back has. So it depends on the position of where you apply, but also the temperature of the skin. You can imagine if I'm warm, I've got vasodilation, the blood vessels come to the surface, you're going to get more going in than if I'm cold and everything's gone in a bit. Also the how many blood vessels there are, what the subcutaneous tissue's like. All of those have a really important effect on the absorption through the skin. And then even when it's absorbed, the metabolism of the hormone, how it's taken up by the blood system, goes into the central blood system and everything else as well. And we've known that for many years. So the absorption really varies between women, and some studies have shown there's a 10-fold variation between different women.
Yeah.
And the same with the gel as well, it's exactly the same. So
Yeah.
it's not necessarily the most effective way of having the hormone, but we do it because if it does get through into the bloodstream, there's no risk of clot or stroke. It's just very easy. It just gets absorbed straight through. But tailoring the dose is really important.
So why do you think men, if they go on TRT,
Yeah.
will have to inject it? Probably intramuscularly, whether it's in a shoulder, leg, or maybe subcutaneously, but I don't think it works as well compared to taking a cream. Is it because of the absorption rate? It's just men would need a lot more, right?
A larger amount, but I think it's also really important, and I'm not a male testosterone expert, but there are different types of testosterone,
The
same
esters,
like
yeah.
about different types of estrogen. When I prescribe any of the hormones, I prescribe the natural body identical hormones, so the same structure. With testosterone, if you use it as a gel, it's the same formulation. So For example, my husband uses testosterone, but he uses the gel, and he uses a
Does it work?
Yeah, lot larger volume than I'm using, but he still uses it, and it works well.
Is he getting the levels checked so he can see?
Yeah. Whereas, obviously, for some men, they don't absorb very well. So then the injection, but a lot of the injections are not the same as the pure testosterone. They might have a different chemical structure, so then they might affect the people in a different way.
Do you know what testosterone that is?
What
testosterone? That your husband's
He's just using pure testosterone, so it's just testosterone gel.
So it's not like an enanthate or
no, it's just testosterone.
Is that prescribed?
Yeah.
What,
so
NHS?
Yeah.
Really?
Yeah.
So he must have, to get it off the NHS, he must have had a very low level.
It's about choice, really. Some of the testosterones that are injectable have lower risk than others. But this is where testosterone gets a bad rep, really, I think.
Yeah.
Because there are a lot of synthetic testosterones that do have a risk of heart attack, stroke, clot, and side effects.
For men?
For men, or women if they injected it. And that's where the problem was when they first discovered testosterone in the late 1930s and commercialised it. Suddenly people will realise that it would give them a performance advantage, it would help them build muscle. But this was the synthetic testosterones. The natural testosterone will just restore people in a physiological way. And I've taken testosterone for 10 years, but all it's doing is restoring me. I don't shave in the morning, I don't have a weird body shape.
Yeah, that's the scare. Women think if I take testosterone, I'm going to grow a beard.
Yeah, and that's the thing. And whereas obviously men have higher amounts of testosterone than women. If they are low, then they need to have higher doses than women. If they don't absorb it, then there are injections. But there's about 300 different types of testosterone. So any men that's listening, you need to make sure that you're on one that's the most body identical one as well, because they all can have different risks and side effects. And that's where I think very strongly that us as patients, if you like, have to do your homework. It's not just relying on the doctor.
Yeah, okay. All right, so last but not least, then we'll just talk about the importance of muscle mass for women. So I coach men and women, lots of women, and many have come from doing HIIT in the park at 6 a.m. and battle ropes and sprinting up and down halls and stuff, and they'll come to me with good jawlines, good necklines, but a little sticky out tummy, and say, why is my tummy still sticking out when I'm training like this and I eat healthy? It's because, and I tell them it's because the cortisol levels have raised so much through the stress you're putting your body through. You get that melted candle look, the soft look, and it may look worse than you did when you started 3 or 6 months ago with some overhangs here and there. And take a step back, what is that correct? And most of them go, well, yeah, why aren't I tight and lean and harder? It's because they're not doing any weight training and eating the right food to fuel that machine of theirs. And when they do start weight training and eating right, that tummy goes and it's like there's air being sucked out of them. Everything starts to tighten up and stuff. How, in your view, how important is muscle mass for women as hormones change, and what are the long-term consequences when women stop lifting weights or underfuel themselves at this stage of life?
It's crucially important because without hormones, people get osteosarcopenia, so loss of bone and muscle mass, because our hormones help to build our muscle. And I think in the past, people have thought muscles are something you look at and admire, but as you know, they're metabolically active.
Yeah.
It's not just about how you look in a mirror, it's about your future health. And also, I want to be physically independent. I want to get out of the bath when I'm in the 80s. It's not so much about how much time it takes me to run a marathon.
Lifting grandkids.
I want to be able to lift the grandkids. I want to reach
Carry
the
a
cupboard.
suitcase.
Yeah, all of that stuff. Like somebody asked to lift my suitcase up some stairs the other day, a young lad. It was very nice of him, but I nearly lamped him. I said, you know what, I can do this actually. But I want to be independent.
Yeah.
So that's really important. But without hormones, it's fact. It's physiological fact that we will get loss of our bone and a muscle mass. So obviously replacing hormones is important. Without the hormones, our metabolism changes. So a lot of people find that they put on weight doing exactly the same exercise, exactly the same diet, because their metabolism, their ability to utilise the sugar and the glucose is completely different. Without all three of those hormones are really important. But also, if our body doesn't have estradiol, it needs to find some estrogen because, like I said, it's really important for the way that our cells work. So it finds estrone, which comes from our fat cells. Estrone is a very weak type of estrogen, and it's often the fat cells in the midline. So it's very common that people put on weight because their body's trying to give them some estrogen as well. As you know, when you exercise, your metabolism is going to change as well. If you can build muscle, that's going to help as well. A lot of people find it's a lot easier to exercise, and I'm sure you've noticed that some of your clients when they've got hormones, testosterone, progesterone, estradiol. Progesterone is very interesting because it's a bit like a seesaw with the amount of cortisol. So if you have low progesterone, you have more cortisol, the stress hormone in your body. So a lot of people find when they have progesterone, you know, they feel calmer, they sleep better, they don't catastrophize in the same way, but they have less cortisol. So that's going to help them with that exercise as well. And then if they've got raised cortisol and they're doing the wrong sort of exercise, I think that's just, it's not right.
Yeah.
We also know how important, you know, more and more people now, aren't they, talking about lifting weights, doing weight training in the right way for them. And I'm no expert, you're the expert here, but I think people have been doing the wrong type of exercise for too long. And
agreed.
I've seen it as a doctor for many years. You know, I'm not a runner at all. And I look at people and think, oh, I'd love to run. And then some of my patients get to my age, they've got no pelvic floor, they've got no core. And I'm like, hang on, I've done yoga and my pelvic floor, my core is strong.
Ankles, knees, bottom of your back.
Absolutely. So I think also the other reason that I do yoga is it keeps me mentally strong and physically strong. And I think that's really crucially important with exercise. It's not just to be physically strong. It does help people mentally too. I do my Pilates once a week. Yeah.
Just before we end it, I was just interested to know genuinely, hot and cold, as in saunas, cold water therapy. Any views on that?
Yeah, I've got an infrared sauna.
Oh, and how do you find it?
I love it.
And what about cold water?
It's got red light panel as well, actually. But I'm very interested in longevity and reducing inflammation, especially with my migraines.
Yeah. Do you find it's helped?
Yeah, I mean, I use it every day. I usually do yoga in the morning and then I go in it. And
so the heat?
Yeah. So
you won't get in the cold?
No, my husband's got a cold outside plunge. But the reason that I don't is just because of my migraines. My migraines ruin or rule my life and any extremes. And that's one of the reasons why I'm not a runner. If I was doing high cardio exercise, I'd get a migraine. So I'm really limited, actually.
Yeah.
And again, I'm just worried about if I went from hot to cold, it would trigger a migraine.
Have you tried it?
No, because honestly, my migraines paralyse me.
It might zap it.
It might do.
But you don't want to risk it.
I don't want to risk it. But I think, you know, as long as people do things carefully, I'm very much for trying things and see if they work.
Yeah.
I'm not for trying things that just are ridiculous, like taking supplements, you don't know what they are, like don't damage yourself.
You don't know if you need them.
But what is the harm of trying something? Like you say, I always say to people, try something for 3 months, then reflect and think, is it worth it? Same with exercise, isn't it? If you're not enjoying it, try and find something else.
Yeah.
Because you won't do it. It will just be a fad otherwise.
Exactly. You've got to want to do it.
Yeah.
Fantastic. That was amazing. Thank you.
Thank you very much.
Can I get a photo?
Of course you can.
Wonderful.
Yeah.